thank you so much for having me here. I'm really glad to be able to share some of this information from you. I was fortunate enough to also give a talk a couple weeks at one of the other webinars, but hopefully if you were on that one, you'll be able to learn some new details that maybe you missed the first time around. So just to kind of give you a brief overview that, you know, when we talk about genetic conditions, there are some genetic conditions that are really simple. It may be that there's only one gene that causes people to be affected with that condition. But really what we're talking about today is a group of diseases. So the group of diseases would be inherited retinal diseases. So of course that includes conditions such as RP, Stargardt's, choroideremia, Usher syndrome. If we look at all of the diseases as a whole, the consequence of all these IRDs is a loss of photoreceptors, which causes vision loss. And that can mean different things for different people. So in some people who are affected with an IRD, you may have a loss of central vision. In some other people, it may be a loss of side vision. Other people may have night vision problems. Other people might have sensitivity to bright lights. But really all of this is because of a loss of the photoreceptor cells that causes vision loss. So that's kind of a commonality for the whole group. But really, we have to think of this group of diseases as many different diseases that all fall under the same umbrella of inherited retinal diseases. So this just kind of gives an image which is showing the number of different genes which have been identified over time for these inherited retinal diseases. And so really there's many, many different genes which cause these diseases. And so it's really a complex set of conditions. It's also complex because you can see a lot of clinical and genetic heterogeneity. So what I mean by that is many different genes might cause many different conditions. So if we think about retinitis pigmentosa in people who only have the RP, sometimes you can see people who are also affected with other health problems, such as in Usher syndrome where you have hearing loss. But if we think about just RP, there's really about 80 different genes that can cause people to only be affected with RP. You can see there are many genes that are known to cause LCA, and many that are known to cause cone or cone rod dystrophy. But some of these genes will overlap with each other, and some of the genes that might cause LCA might also cause someone else to be affected with RP. And because of that, this group of conditions is really complex that we really need to understand a lot about. So I'm gonna, before I get into some of the information about genetic testing, I've kind of set the stage that retinitis pigmentosa, other inherited retinal diseases, they're always genetic conditions. So what exactly does that mean? What I'm showing on the screen is a male karyotype. So that's just a picture of the chromosomes from a single cell in a man. We all have 22 pairs of autosomes. Those are the first 22 pairs of chromosomes. And then the last pair determines sex. In a male, you have an X and a Y chromosome. In a female, you have 2 X chromosomes. All along those chromosomes are thousands and thousands of genes. We all have about 25,000 different genes. There are lots of different genes that help our heart function, lots of different genes that help our eyes function. And if you have a mutation or a change in one of those genes, then you can be affected with a genetic condition, such as an inherited retinal disease. When we talk about these conditions, so this is actually a question that I get all the time. If anybody here that I'm a genetic counselor, they'll say, oh, my mom has this condition. Is that genetic? My general response for most health problems is that they're all genetic, but it's just to varying degrees. So we can look at something that, such as a condition called cytomegalovirus retinitis, or CMV retinitis, which is really an infection that affects the retina. That is caused, it's an infectious condition, but you can envision that if you did have a genetic condition that suppressed your immune system, you might be at a greater risk for conditions such as that. In the middle, we have conditions like age-related macular degeneration. Age-related macular degeneration is a complex disease. So that means that there are genetic factors that play into someone developing that disease, but a lot of it is also environmental factors. So things like smoking, sun exposure, vitamins, those are all going to play into your risk of developing or not developing AMD. On the other end, we have retinitis pigmentosa. Retinitis pigmentosa is a genetic condition, so meaning in a single person, there's going to be a gene that causes that person to be affected with that condition. But that doesn't mean that there can't be some environmental factors that can play into that. So there's been, things like smoking is not good for your general health. It's not good for your RP. Vitamins are generally thought to be beneficial for patients that are affected with inherited retinal conditions. So while it's a genetic condition, there can be some environmental component that's going to maybe modify the way that someone is affected with the condition. So when we think about, this is kind of switching a little bit to thinking about the clinical applications of genetics and genetic testing. So I'm one of the 2 genetic counselors at the Kellogg Eye Center, and we meet with all of the patients that are in our inherited retinal dystrophy clinic. And one of the first things that we do with them is draw a pedigree. So a pedigree just shows the family relationships within a family. Sometimes there's only one person affected. Sometimes there might be multiple generations of the family that are affected. But that sort of information helps us to understand a little bit more about the condition and perhaps about the genetic cause of the condition. So this is just a very small pedigree of a nuclear family showing a son, daughter, mother, father, and the son is affected with the inherited retinal disease, and that is why he's filled in. And the arrow means that he was the first person in our clinic that from that family that helped us to understand that there is a genetic condition within the family. However, I would never have a pedigree like this. They're always much more complex. And this is one thing that we might see where in this family, a father, son, and grandfather are all affected with RT. There was also an aunt that had low vision. That wasn't really known if it was due to RT or something else. You can also see that the mother's father, he is listed as deceased, and also the father had siblings that were identical twins. So this is all just helps us to understand the relationships and the structure of the family. So I'm going to go through some of the examples of, there are 3 primary inheritance patterns. This is one that demonstrates autosomal dominant inheritance. In autosomal dominant inheritance, you can see both males and females that are affected with the condition. And typically, you would see multiple generations of the family that are affected, although sometimes we do see it where there might be a single person in the family that does actually have a dominant gene mutation. You can see both, again, males and females affected, and each child of an affected parent has a 50% chance for being affected and a 50% chance for being unaffected, and that is based on whether or not the gene mutation is passed on to that individual. Another one of the 3 common inheritance patterns is autosomal recessive inheritance. In autosomal recessive inheritance, again, you have males and females that are equally likely to be affected. It affects both genders. Mutations have to be found on both copies of our gene. So all of our genes come in pairs with one inherited from mom and one inherited from dad. In order to be affected with a recessive condition, you have to have both copies of that gene not working in the proper way. If both parents are what we call carriers, meaning they have one working and one not working copy of the gene, each time they have each child has a 25% chance for inheriting both of those disease-causing genes and being affected. Here they happen to just have 2 of their children who inherited both of those mutations and are affected. There are 2 other children that are carriers, again, carriers of these recessive conditions. We generally don't show that they have signs of disease. And they have 2 individuals who are not carriers and not affected with the condition. The third primary inheritance pattern is the X-linked type of inheritance. In this condition, the mutation is located on the X chromosome. As I mentioned before, females have 2 X chromosomes, males have an X and a Y chromosome. This condition, in X-linked conditions, it's typically seen in males who are affected with the condition and females who are carriers. We do know from looking at some of our families, for example, some of our X-linked RP families, where some of the females who are actually carriers of this condition can show signs of disease. Sometimes it may be that it may impact their vision. Sometimes it may just be that when they have the clinical exam, they'll find some signs of the disease. When a female is a carrier of the condition, each time that she has a child, each child has a 50% chance of inheriting that disease-causing gene and then being affected. So in the instance here, each time she has a son, each son has a 50% chance for being affected with this condition, and each female has a 50% chance of being a carrier of the condition. So now just to talk a little bit about genetic testing. So when we think about genetic testing in the inherited retinal disease clinic, it really has been kind of an evolution over time of the type of testing that we're doing. So back in the 1980s, 1990s, if looking at the graph, we actually only had a small handful of IRD genes that had been identified. At this time, genetic testing was primarily done in research studies on families to identify new IRD genes, or individuals were tested for only a small number of genes because really we only had a small number of genes during that time. Throughout the 1990s to 2000, there was a development of a small number of clinically certified, they call them CLIA, testing labs throughout the country. We had one at Kellogg, there was one, Edstone in Iowa had one as well, the Kari lab, and there was a couple of other labs similar to that across the country that really kind of expanded the testing that was available. And testing was either done on single genes at this time or often small panels of genes. Again, getting to the fact that the number of genes that have been found has really been increasing greatly over time. In the 2010-ish, around that time, we were seeing the development of large, broad panels of genes, and testing was expanding out of ophthalmic-specific labs, which were primarily located at academic medical centers, and really into commercial labs. And by that, I mean genetic testing labs that might do testing for cancer or heart disease or that kind of thing. They were expanding to those labs who started offering ophthalmic panels as well. Now we're getting to the point where there are some labs that may offer whole exome, whole genome testing that has been greatly expanding over time. So why do I say this? Part of the reason that I mention it is some people may have had research testing that was done maybe in the 1990s. Maybe at that time it was only tested for a small number of genes. And if it was a negative test at that time, really now is the time to think about getting tested again on some of these larger panels. We've come a long way with the testing that's available. So why do we do genetic testing? Why should you even bother doing this? In many cases, it's done to confirm the diagnosis. Sometimes it can be unclear exactly what the diagnosis is, and sometimes doing genetic testing can help that. It's important to understand the inheritance, which then allows for accurate genetic counseling. As I mentioned before, I showed those diagrams that showed the 3 common inheritance patterns. And many of the families that we see will follow what we see in those, but sometimes it's very challenging to distinguish between, is this an autosomal dominant pedigree or an X-linked pedigree? Sometimes you can't tell. And in those cases, of course, doing genetic testing may help to clarify that information a little bit. In some cases, there may be different recommendations based on the genetic basis for disease. For example, sometimes it does happen that when we do genetic testing, we thought it was going to be a non-syndromic condition, meaning we thought it was just going to have the eye findings, but sometimes we do identify genetic mutations in genes, which would indicate, hey, this is actually a syndrome, and there may be other health conditions that the patient should be screened for. That's a pretty small chance of it happening, but it definitely does, and it can have important implications for kind of other health concerns. And especially now, another reason, kind of the 4th main reason that I generally give for why we do genetic testing is potential therapeutic options. As you're going to hear from Ben and some of our panelists shortly, there's a great number of different clinical treatment trials that are being developed. We do actually have one clinically approved treatment, the Luxturna treatment for patients that are affected with gene mutations in RP65. So we consider doing genetic testing kind of the first step for understanding what potential therapeutic options, if any, are available to you. So is genetic testing for everyone? You know, I think it's for people that are affected with inherited eye conditions, it's usually kind of a no-brainer that we're looking to kind of confirm the diagnosis and some of those other things that I just mentioned. But where it can be that maybe genetic testing isn't for everyone is people who are currently unaffected with disease. We call that pre-symptomatic testing. And is that something that you want to know? If you don't currently have disease now, but other family members do, some people may want to know in the future what is coming, whereas other people will say, hey, if there's no treatment for it, then I don't want to know exactly what the genetic cause is. And it's important to also understand that there can be some variability with how people are affected in the family. Some people may be affected more severely, some more mildly, and genetic testing is not going to tell you that. Genetic testing is going to tell you whether or not you have the mutation. It doesn't tell you what age you're going to develop it. It doesn't tell you exactly how severe you're going to be. Similarly, would knowing that other family members or offspring were at risk, would that make you more worried, or would you get some reassurance if you had the genetic testing done? So these are important considerations to talk with a genetic counselor or your healthcare professional about. So how does someone generally have genetic testing done? Typically, patients cannot submit samples on their own. It's something that they have to work with their healthcare professional. There are some ophthalmologists who are very familiar with genetics and genetic testing. There are others who are not so much. So some ophthalmologists may be comfortable ordering this testing, whereas others may not. But if your ophthalmologist was not comfortable ordering the testing, you can always seek out a genetic health professional, such as a geneticist or a genetic counselor, who could help you navigate through that process. When you do genetic testing, a sample, which may be a blood sample, a saliva sample, or a buccal swab, which is a swab that is done on the inside of your cheek, and paperwork, typically including a consent form, are sent to the lab. The lab analyzes the sample, and then once those results become available, they will go back to the healthcare provider. So one of the questions or issues that we've definitely had over time is, how is this going to get paid for? The traditional way of paying for genetic testing is that you or your insurance company are responsible for the cost of the testing. We've worked with a lot of our patients to try to get insurance authorization, and generally we're able to do this on about 50% of the patients. Some genetic testing labs actually may work on obtaining that prior authorization for the testing. So your doctor doesn't necessarily have to do it. It's something that several of the labs are doing now, especially the larger labs. That's something that they'll typically take care of. And some genetic testing labs may offer reduced out-of-pocket cost for the testing if your insurance does not cover it, or payment plans for the testing. And just to give you an idea, again, how this genetic testing has evolved over time, when I started doing this, there was a lab that was offering genetic testing for one gene, for the ABCA4 gene, and the cost of the testing was $800. The panel that we're using for a lot of our testing now is through Blueprint Genetics. Now they're offering a panel that's 322 genes. The cost of the panel is $2,500, but they actually do have some reduced out-of-pocket costs for people whose insurance won't pay for that testing. But we're also fortunate now that through FFB, they had started, I believe it was last fall, an open access genetic testing program. This basically provides genetic testing at no charge to the patient. The people that are eligible for this are diagnosed with an IRD, who are US citizens who haven't recently had large-scale genetic testing. And I think Ben will mention this a little bit more, and there also is additional information on the Foundation Fighting Blindness website. You can click on the button that's about genetic testing, and they provide additional information about this open access genetic testing program. But we're really fortunate that this sort of thing is available for our patients to help them understand more about the genetic basis for their inherited eye conditions. So just to give a little bit more information of what happens to the sample in the lab. I think genetic testing kind of gets this amorphous, oh, we're not exactly sure what happens. Well, it's actually pretty simple. So you take a blood sample, saliva sample, or as I mentioned, the buccal swabs, and that's really going to be dependent. Different clinics might have different things available of how they can obtain the samples. DNA, your genetic information, is extracted from that sample. And then the lab will have what they call a reference sequence. So the reference sequence is just a normal sequence of the genetic information, and they will compare that sequence to your sequence and see if they can identify any mistakes or mutations or changes in the gene that are going to make the gene not work in the proper way and could be causing your eye condition. So after the results come available, as I mentioned, they'll be returned to the healthcare provider. I actually meant to mention as well, through that FFB program, the open access, genetic counseling can be available to patients who have that testing done through that program, which is great because the genetic counselors can really help kind of understand the information. Sometimes the results that you get are clear. Sometimes it really will give a clear answer, but that doesn't always happen. So it's important that people understand upfront that the genetic cause may not be identified and or may be inconclusive, which means we're not exactly sure how to interpret the results if there's variants of unknown significance that are identified. Sometimes also it is helpful or needed to test other parents and or other affected or unaffected family members to deal with the interpretation of the genetic testing results. So after these results are come back, it is recommended that there would be a discussion of these results with a healthcare provider. So that would be not only an interpretation of the genetic testing results, but a risk to other members of the family and a discussion of what follow-up is needed. Sometimes that may be testing other family members. Sometimes it may be what sort of treatments or clinical trials are available for patients with this genetic diagnosis. And are there other health problems that could be associated with mutations in the gene? So I've kind of alluded that the perfect healthcare professional to do a lot of that is a genetic counselor. So genetic counseling is basically the process of helping people to understand and adapt to the medical, psychological, and familial implications of genetic contributions to disease. So this really includes things such as interpreting family and medical history, educating about inheritance types, genetic testing management, prevention, resources, and counseling to promote informed choices and adapt to the risk or condition. So as I mentioned, FFB through their open access program, that does incorporate genetic counseling into that program. There are a number of large academic medical centers who do have genetic counselors that work with their inherited retinal dystrophy patients, or some who are just available, might not specialize in inherited retinal dystrophy, but are available at the medical center to provide that counseling. Even if there wasn't one, genetic counselors were in most large cities. There actually are about 50 ophthalmic genetic counselors around the world who specifically work with these patients, but there's a whole lot of other genetic counselors who are really trained to work with patients affected with any genetic diagnosis and who can help with understanding this diagnosis and what sorts of things might be available out there. So that's the end of my part of it. Hopefully you've had a good understanding of a little bit more information about genetics, genetic testing and genetic counseling. I know we're not doing questions at this time. I will happy to answer any questions that there may be at the end of that.